For those who have joined in the last couple of minutes, welcome to the weekly conversation with the Lieutenant Governor. Thank you for accommodating the last minute change of plans. The Lieutenant Governor requested moving our call so that he and the Governor's Chief of Staff, Justin Harding, could chat with local government leaders prior to the Governor's press conference at 1:30. So the Chief of Staff and Lieutenant Governor will have to leave at 1, but Brandy, Grace, and I will stay on the call to answer questions as best as we can. The original focus of this call was going to be the process for switching from red to orange at a statewide level, what the local decision-making process would look like within that state framework, the distinctions between whether the governor would issue an order versus a directive to move from red to orange, the access to PPE and sanitation supplies, and the overall messaging to the general public that there is no one-size-fits-all to the implementation of orange, and that the beginning of orange, or that the stabilization phase is a beginning, not an end, when the directive expires. We anticipate the Lieutenant Governor and Chief of Staff Harding will address some of those points. We went through all of them last night and this morning with them to make sure that they were prepared, that those questions were top of mind for local government leaders. So whatever they can't answer before they have to leave at 1, their staff told us they would follow up with us in the next couple of days to help provide answers. Randy, we are well past 200 now.
Oh, wow, I'd say. I see Kirsten.
It looks like Lieutenant Governor Cox is on, from what I can see.
Okay. Lieutenant Governor, are you there? Lieutenant Governor, are you there?
You know what, you guys? I thought he was about to be, and let me go double check. He's just on the other side of that
wall.
And Justin is on.
Perfect. Justin, are you there?
I see him, but it won't let me unmute him. So I don't know if he's not got his, oh, there it goes.
Here we go.
Can you hear me?
We hear you.
Justin, we can hear you.
Cameron was worried I was going to put some inappropriate things up on the website, so he wasn't going to allow me to unmute myself.
Too soon. Well, Justin, we provided the background for the call already for both you and the Lieutenant Governor, and we appreciate that both of you have made time before the press conference to join League and UAC members. We have nearly 300 on the call from around the state. Brandy and I plan to stay on the call after you leave at 1 to continue answering questions. And you may not be able to tell, but I'm wearing a tie that has orange in it. And so you'll have to let me know if I dressed appropriately for our conversation today.
I guess I should have worn another color other than red. This is SUU Thunderbird red is what we've got going on.
There you go. There you go. Well, Chief, do you want to start before the Lieutenant Governor arrives, or do you want to wait for the Lieutenant Governor?
I can defer to him if he's coming shortly. If not, then I can give a little bit of a preview here. I know that he had some other commitments he was trying to manage.
He is here, but not unmuted. So if whoever has there we go.
There we go. Thank you. Sorry, it wouldn't let me unmute myself.
Oh, I should have worn a white.
Okay, perfect.
Hey everybody, it's great to be with you. Thank you so much for being versatile and moving the call up on our behalf today. This is really helpful and something that the governor wanted us to do in anticipation of his announcement at 1:30 today. And I'm grateful to have Chief Harding on here who can help answer many of the questions, as he's been very involved with the governor and this decision. As I think all of you know, the recommendation came to the governor last week to move us from the red phase into the orange phase of this pandemic response, and he will be announcing in an hour that is indeed what he is going to do, following the new legislative the new law that was put into place with the legislature. He will be announcing that the previous orders will expire, and a new order will be entered, moving us from red to orange statewide. Now, what I would encourage all of you to do, because I know everyone has many questions, and I want to point out that we are not going to be able to answer all of those questions. It's just impossible for every single job, every single business out there to anticipate what those questions are going to be. So there's going to be a little bit of figuring this out. The good news is that the Utah Leads Together plan has incredible detail in there to help everyone get at least a general understanding of what it means to move from red to orange. As has been said so many times, this is not a light switch. We're not going from off to on, but it is a really important step, and we'll be one of the first in the country to take this step as we move from red to orange. Now, when you go to coronavirus.utah.gov, and hopefully you all have the link, there's one there for the Utah Leads Together 2.0 plan. You want to click on the 2.0 plan, and then the important piece is really the addendum that is associated with the plan, and it's the phased. It says you can click here to read the full document, or the color-coded health guidelines. The color-coded health guidelines is the place that you're going to want to go to see the details. And again, it's 20 pages, multiple columns showing what the breakdown is for all of these different areas. There are guidelines for the general public. There are guidelines for different businesses. This has been everyone has worked so hard in this. I know Cameron and Brandy have been involved. We've had over 80 industry associations and hundreds of businesses that have helped work on the guidelines here, best practices for business. I think most importantly, just kind of from a general understanding, are that social distancing, that 6 feet rule, is still going to be really important. And if you can't do the 6 feet rule, then people need to be wearing masks. And in fact, everyone should wear masks at all times when in public. That's really important piece of this. And of course, there are heightened hygiene standards. Obviously, the important parts that have not been active in the economy that are opening up will be in-house dining. That's kind of the one that I think most people have been interested in. Salons as well, again, while wearing masks, and gyms with increased hygiene and the 6 feet rule in place. So those are really the big ones. I'm sure we have a lot of questions about how this is going to work, implemented, and local feedback on that. And I appreciate having Chief Harding on here. Again, he's been very involved with those discussions. And Chief, I'd love to turn some time over you to fill in the gaps, and we can answer some of those questions.
Thanks, Lieutenant Governor. That was a great lead-in and explanation in terms of the processes that we've been through here internally to come to this point. And this is an important marker in terms of where we are in the state as we try to mitigate the spread of COVID-19. The last 6 weeks have bought us a tremendous amount of time to put in place important processes, to acquire PPE, medical supplies and equipment, to ramp up our testing and our contact tracing, and to do all of the things that were necessary in order for us to have this day when we could have a reopening of those very few industries in our state that have been selectively impacted by some orders and directives statewide. And as the Lieutenant Governor noted, those industries that were the most impacted were, of course, those that were in close contact, or those that allowed for congregating of people in close settings. So restaurants, hair salons, nail salons, those kinds of things, there will be some adjustments that will be made there. I think probably the most pressing questions that are on the minds of a lot of people is process. And how does this new process impact you and the decisions that you might want to make at a local level. We recognize that as we look across the state, not all regions of the state are impacted equally. It's more in our urban core where we tend to have the higher rates of infection, where we've experienced more deaths and things along that nature. And so what our course of action is going forward is if a local business or a local entity feels that because of circumstances within their county, that there should be a more permissible setting in place as opposed to orange, which will be the classification that would be in place statewide, that they would need to take that information and that request to their local departments of health, local Department of Health. And then the local Department of Health would then discuss that with our state Department of Health. Together, they would review and validate the data that is there and available, and then make a recommendation to the governor on what adjustments should be made to make up for a local accommodation. And so what we're seeing with this particular effort is it will be a statewide order. And the reason why we want to do a statewide order is so that there's consistency across the counties, consistency across the local health departments, and so that we're all essentially working together off of the same set of known facts. And then as accommodations are sought to be made for local flexibility, then we can work with that. We understand that in the Utah Leads Together plan that there are allowances for local communities and counties to have less stringent color coding systems in place than, say, orange, which is what we'll move the state to effective at midnight on May 1st. And so this will be a 2-week order. And what we want to do is to give us time, understanding that there is a latency in infection. And so there may be exposure that has taken place that would become known to us within a 2 weeks time period. And so in 2 weeks, we'll have better and more informed data about where the infection has spread in other parts of the state. And if those states that currently have very minimal outbreaks continue to have really good numbers, then we believe the justification will be there to change the color coding from those counties from the orange or the more restrictive measures to yellow. And so that's what I wanted to share right now. I know that there's probably questions that people have about how this impacts family reunions and other activities, and we're happy in the time that we have available to take some of your questions.
Brandy, you want to take the first question?
Just a sec, Cam. I'm trying to pull up my notes here.
Brandy, while you're doing that, Kim Carson asked the question. She said, what about more restrictive? And so it works in both directions. The new law requires that in order for a county or a community to be more restrictive or less restrictive, they cannot do anything that is in contradiction with an order that has been issued by the governor that's based on a recommendation from the Public Health and Safety Commission. So there has to be that coordination on the part of local health departments with the state in order to be more restrictive. And because we are seeing some hot spots in the state much more locally within individual cities, then we'll be working with the local elected officials in those instances to make a determination as to how to protect the populations within those areas with respect to this color coding system and the newly passed law.
Justin, when you said midnight on May 1st, that means that you're essentially saying 12:01 on Friday will move to orange for the rest of the day. So whereas the directive expired at the end of the day on May 1st, in actuality, we're moving to orange at the beginning of the day on May 1st. Correct?
That's the direction that we would head, Cameron, and we recognize that the directive that's in place right now, it's just that, it's a directive, and the order would naturally supersede the directive. And even though there would have been an overlap, orders always supersede directives.
Yep. Yep.
Someone asked a question about what about the OPMA that will allow us to hold virtual meetings at least through June. Any suspensions of law that the governor has put in place, those suspensions would remain in effect unless and until there's a time certain provision in there that would cause those suspensions to be changed. And then under the new law that's been passed by the legislature, if there's an order that needs to be extended or a new order that needs to be released, we just need, so long as it's not an emergency issue, one that pertains to life, health, safety, protection of property, then we would just need to give them a 24-hour notice and would likely extend those. And so that virtual anchor meeting location directive stays in effect.
Yeah, it stays in effect until June 30th because there was no date certain in that OPMA executive order.
That's right. I'm seeing a question here. Is there any direction on city summer celebrations when it comes to the number of people gathering? Cameron, you may want to have a conversation with your league members on this, but we're not ready to announce a policy yet with regards to summer celebrations. We feel that it's premature to announce that. And so in the coming weeks, I think as we communicate with the league and with other associations in the state, then we would be making recommendations on what to do with summer celebrations, whether that be 4th of July. We know down in Utah County, they have the big Freedom Festival, and there are a number of festivals that are important, and we want to figure out a way to make those work if we can, and we've got to see what the data says and what would be allowed in those cases. So
perfect. And Mayor Reese, by extension there, the internal group on live events is meeting this afternoon trying to figure out if there is a path forward on those best practices. So stay in touch with us over the next week or two as we transition into the orange phase. Brandy, do you want to tackle a couple of your questions?
Well, if we could just get a little bit more specific, Chief. You mentioned that local orders, they should be coordinating with the state, but can you be a little bit more specific on who exactly should we be coordinating? Who can we tell our members to reach out to as they're drafting their own orders or considering issues in their own community?
That is a very good question, Brandy. And so let me just say at the outset of this that the Office of the Governor, in terms of our executive staff here, we don't have the capacity or the bandwidth to negotiate with 240 plus communities, nor with the 29 counties. And so we are not the ones that you would bring those questions to. We would ask that you work with General Burton and his staff within the Department of Health when you have order-specific questions that may be either related to more permissive or more restrictive conditions than what will be in place with regards to the 2-week order that the governor would be putting forward.
Thank you.
Perfect. Chief Harding and Lieutenant Governor, can you give us an update around the acquisition of PPE and sanitation supplies? We've heard from a lot of local governments around the state who are concerned about the access, not just for them as local government entities, but for the businesses and residents in their communities so that they can function under the orange guidelines.
I'll defer to the Lieutenant Governor.
Thanks, Chief. This is something that we're well aware of, Cam, and working closely as we're, again, as Chief mentioned, one of the reasons that we've done what we've done over the past 5 or 6 weeks was so that we could do as much as possible to build up those PPE supplies, and specifically with our frontline workers. The good news is we're feeling a little better about the coverage there, so that's why we're able to do some of these things. Now, we recognize that puts businesses in a difficult situation trying to obtain those supplies for themselves. We are working with local health departments again as we acquire that PPE to be able to distribute that, and we're going to have some other announcements about the availability of PPE. One of the things, as we talk about the importance of masks in public, we're going to be announcing today a project that we've been working on with local manufacturers here in the state of Utah to manufacture a mask for everyone in Utah. Now they've been doing that. I believe they should have 500,000 ready this week. Those will start to be distributed next week. Again, that's going to take a little time to get those out to people, and so we're going to have to be resourceful and figure some things out on our own, and trying to help each other out, and we're working through that. But Jess Anderson, the Commissioner of Public Safety, and they are working with your emergency people again at the 13 local health departments to work on getting more of those supplies and getting them distributed where they can. Obviously, the first priority is to our healthcare workers and first responders, our long-term care facilities, and those that are most at risk, our homeless communities and others. But we want to be able to help get those out to businesses, and as those supply chains loosen up, we believe that we can help bridge some of those gaps. Chief, I don't know if you have anything to add to that.
No, that's great. Thanks, Lieutenant Governor.
Perfect. Brandy?
Yeah, a follow-up question to that. Do you know if the counties or cities who are able to procure PPE, do you know if any of the CARES Act funding or even FEMA would help with the reimbursement for those expenses if that PPE is being used to help businesses in their communities?
I think the answer is yes, Brandy, but let me find out before you quote me on that one.
Okay.
So let's get some additional information to make sure. But I believe that's the case. I know we had this discussion once before, but I need to follow up and see.
Perfect. And Lieutenant Governor, Chief Harding, the League and UAC have been working together with John Ball and with the executive branch and others to try to figure out the next steps on the CARES Act funding. So Lieutenant Governor will continue making that conversation happen. By extension, the Utah Manufacturers Association, I know, is working on a storefront where local manufacturers who are providing this PPE will have an opportunity through the coronavirus.utah.gov website to be able to share information about where it can be obtained. So the next question is really around social distancing in the orange phase. There has been a lot of back and forth about that underlying principle of social distancing and what the expectation is around social distancing while we are in orange. That social distancing in a family context, in a public context like at parks, live events, church, school, and the like. So Chief and Lieutenant Governor, what else can you share around social distancing expectations during orange?
Again, you're gonna get tired of us hearing this, but everyone needs to go and pull down that 20-page document and actually read it, because you're going to be getting these questions from everyone, and I'm happy to answer those here. But if you're asking that question, I know you haven't looked at that document, because it is all included in there. It talks about, so we do move from a limit on gatherings from 10 to 20. But again, there is really strict guidance in there about the type of people you should be around, immediate family and those who have actually been following the social distancing guidelines, so that we're not putting each other at risk. And those who are over the age of 60 and who have underlying health conditions should still practice strict distancing, and in fact should stay at home as much as possible. Again, moving from red to orange isn't moving from red to green, and we are still encouraging people to limit travel. We are still encouraging people to work from home if at all possible. We are still encouraging people to limit interactions around shopping. It's to be, we are opening these things, but again, be very, very careful. This disease is still here, hasn't gone anywhere. It will expand if we are not extremely careful. And the last thing we want to do is to have to turn the dial back the other way, because we've seen explosive growth, and we're having some of the problems that have been seen in other states. So this is true. There is a section, one of the first sections in there, talks about events and the distancing there. Now, I will say there is a change, and Chief, correct me if I'm wrong, but in the social distancing guidelines under the new plan, it does use 10 feet between people in restaurants for sure, and it may in mass gatherings as well. But the governor's order will actually follow the CDC guidelines, is my understanding, unless that's changed in the last 24 hours, Chief, and be 6 feet. Is that accurate?
Lieutenant Governor, that is correct. We have updated it to 6 feet in all instances, and particularly in restaurants, that the distance is six feet between patrons at adjoining tables. And so it's not 10 feet, and it's not 6 feet between tables, because 6 feet between tables could really be 2 feet between people by the time you fill it in. So it's patrons must maintain that distance of 6 feet in a setting like that. And there are some really good guidelines that have been issued in that document the Lieutenant Governor has referenced. And there's an addendum as well that's industry specific that will take you through what each industry needs to be working on in order to maintain really good measures within the workplace and within places of business that serve the public. So look through that and become familiar with it. And I believe Cameron and Brandy will spend some additional time with the group in that document when we sign off, answering a lot of those questions.
And Chief Harding, Lieutenant Governor, it's also important to point out that the 2.0 document is a living document. So as we start implementing it, and businesses and local governments and the general public are implementing it, we may find innovations that aren't in there yet, and we can add to those as long as the underlying principles are met around social distancing, sanitation, and public health, correct? I think that's a key point to emphasize.
Correct.
Brandy?
Yeah, I wanted to point that out as well. And I think the Lieutenant Governor in his opening comments stated that we just can't comprehend all these little different events or activities, or there's just no way to touch on every one of them. So I think it's important for people to realize, and as a member on the legislatively created commission, we've been talking about further vetting that. And I think it's been a very comprehensive effort. Many, many industries involved in that, but I also feel like we might be getting to a point where we're kind of paralysis by analysis as we're trying to become so specific. I think the general guidance of social distancing and the importance of the 6 foot distance in between people is important for us all to remember. But certainly any input to the guidelines that would be helpful, we're still receiving that. Cameron and I both are involved in those conversations and welcome any input that we have as we further try to vet those guidelines and as we move to the different phases. But I think that that's really important to remember, that it is a living document and we're all learning through this process.
Chief, Lieutenant Governor, can you talk through the timing of when the order will be released? Chief Harding, you mentioned it would be an order, not a directive, but will it be released today? Will it be released later this week? Has that been determined yet?
That's a really good question, Cameron. Thank you. The governor will make his announcement today at 1:30 with regards to that he will adopt the recommendation of the commission going from red to orange. And then our legal team is in the process as of this very moment, and will need to be for at least the next 24 hours or so, preparing that order to be sure that the order is tight and that we get some feedback from everyone. The order will go live, we hope, no later than close of business tomorrow, and it could slip into Thursday. But the bottom line is this is an important announcement that we wanted to be sure that we got out to our friends within the league, our friends in business, the good people of the state of Utah, to let them know that what we've been doing is working. We need to keep doing it, but there are some modifications that are being made to dining in and to hair salons and a few others of those close contact businesses. You know, the definitive document, the order will, again, it'll be done and ready, hopefully close of business tomorrow or Thursday.
Perfect. Thank you, Brandy. Your question.
Yeah, can we also talk a little bit about vulnerable populations? The governor in his press conference on Friday emphasized the importance of reaching those populations who may not have family connections and fit into that criteria of those that have been identified to be at higher risk. Can either of you speak a little bit more on that effort and what's being done and what we can do to help make sure that those populations are informed?
Go ahead, Lieutenant Governor.
Well, thank you, Brandy. And I know that the commission on which you sit, this is one of the, in fact, the governor went back to you all and asked for recommendations around that. We are working with the Department of Health. We're working with the Governor's Office of Management and Budget around other things that we can do to really help and reach out. Ultimately, this is going to be a community effort, and this is where you all are so valuable in what you're doing. We do worry about those who are most at risk and who may not have available resources or good information on how to protect them and keep them safe. Again, we've known with this disease from the very beginning that it impacts disproportionately those that are most vulnerable, especially the elderly and those with health conditions. And as we're learning also, many of our multicultural communities and minority communities that are being impacted disproportionately. And so we are working very closely with you all, again, with your local departments of health, to find ways to better engage and reach out to those. Again, one of the things that I know we're discussing on the Mask for Every Utahn is mailing one to everyone over the age of 60 right away to help make sure that they get them first, those that may be impacted. So we continue to have those discussions, but this is really critical as we move to this next phase. One of the reasons to be in the red phase is to protect those groups and make sure that we have everything that we need. And now as we move into the next one, we're going to want to have to be even more careful that we're not exposing them and leaving them at great risk.
Perfect. Chief Harding, Lieutenant Governor, we recognize that it's 1 o'clock. Do you have any final comments that you want to share with the group? And then as a reminder to the group that Brandy and I will stay on the call to answer the additional questions that have come up in the chat room and other questions that I'm sure are inevitable in the minutes to come.
I would just say thank you to everyone. The last 6-8 weeks have been some of the most intense of my professional life, and I know that's been the case for every elected and appointed official and business person and family and individual across the state. And we've got a great team spirit here in the governor's office, and there's a real spirit of unity and working together across the state. And so we wouldn't be where we are today were it not for your leadership at the Utah League of Cities and Towns and your membership and your local officials. Because this is a dynamic and changing situation, adjustments will likely need to be made as we go forward. And we just ask for your patience. And if you have questions or concerns, you can raise those through the channels that we've discussed as it pertains to the orders. Your leadership knows how to get a hold of us individually. And again, when it comes to elected officials, our doors are always open. We are happy to jump on a call with mayors and county commissioners and others just to walk through their questions and concerns. So we wouldn't be where we are without the great collective leadership across the state. So thanks very much.
And yeah, I just want to echo what Chief Harding said. I couldn't agree more. I want to thank you, Cameron, and Brandy, the League, and UAC for your incredible leadership. To our local officials, you are the ones that have gotten us where we are today, that have made this work, that have helped to flatten that curve, that have helped to build up our supplies. It's just been incredible to see the hundreds and thousands of people that have come together as part of this effort to make it work. Yeah, we've made some mistakes along the way. But if you told me 6 weeks ago that after everything we were seeing that we would be in this spot today, I'm not sure any of us would have believed it. It's just been an intense ride, and we have a lot of work to do as we rebuild the economy. And this is a critical piece. I just want you all to know we're working very closely with the White House. We have calls at least twice a week with the Vice President, and the President is there most of the time. We're having direct discussions. They continue to point to Utah as a real leader in our increased testing capacity, our tracing capacity, our ability, again, our low numbers, high testing, low mortality rates, and that's what's led us to be able to be one of the first states to really start to open things back up. But we don't want to backslide, and so we desperately need your help reminding people that this thing still matters. It's easy to get complacent, and it's easy to say, yeah, I don't, masks are dumb. Why are we doing this kind of stuff? And look, I get it. I hate it too. But it's a lot better than where we are right now. And if that's what it takes to get us moving back and still protecting the health and safety of the most vulnerable Utahns, then I believe it's worth it. And I believe we can show the rest of the nation how to do this right. And we were the best economy in the country before, and we will be again. So thanks for your help, and we'll continue to work together.
Thank you, Lieutenant Governor, and thank you, Chief Harding. One parting comment from me before you leave is Brandy and I both meet regularly with our counterparts in other states, and we've heard the horror stories of governors or legislatures that are excluding local government through this period of time. And we're proud to be in a state where a governor says he believes in local control and local decisions, and that he does not believe in one-size-fits-all approaches, and he's practicing what he's preaching. And we're seeing that here, and that's a unique approach compared to other states in the country. So on behalf of local leaders around the state, thank you for your collaborative efforts. And please thank the governor on our behalf. Perfect. Okay, well, Brandy and I will stay on the call to answer additional questions that came up in the chat box. So if you need to go, feel free to go, but you're also welcome to stay. So Cliff, your question was answered about the OPMA exemptions. One thing I will add, though, is that we attempted to codify the anchor location exemption in House Bill 3009, but unfortunately, that bill did not pass in the special session last week for other political reasons that we explained in Friday Facts. And so it's possible the legislature may consider that codification in an upcoming special session, but at the very least, between now and the end of June, those OPMA exemptions under the executive order will apply. I should also note that there is an executive order on housing, and that precludes evictions under certain circumstances. That executive order is date certain. It expires May 15th, and there is a working group that's working on potential next steps. That working group actually will meet at 2 o'clock today. Mike, you asked if the governor is issuing an order, not directive. Yes, it will be an order. Gina, you asked, how does local control fit into this? Brandy, is there anything else you want to add on just the process piece? I mean, we asked it in several different ways to try to make sure that there was clarity on it, but anything you want to add on that piece as I scan through the rest of the chat box?
Yeah, let me just say that I'm aware that some of our communities are looking forward to the next phases, especially those communities where they have not yet seen cases being identified. And so, I think getting the direction that we have now with knowing to go to General Burton and his team for efforts in coordinating, I think it was an important piece to get out of this call, because I know that there's been a little bit of confusion over who specifically to be coordinating with. And of course, with the Senate Bill 3004 now dealing with more restrictive orders and coordination with the governor's office, I think that was an important distinction to get out of this call. So I hope that answers your question, Gina. We can follow up further if needed as well.
Perfect. Mayor Reese, Chief Harding referenced the city summer celebrations. Let me just give a little more context there. Chief Harding actually called me shortly after he got off the phone with the Freedom Festival in Provo. I told him about the effort that UAC, the League, the Salt Lake Chamber, and other groups are working on around live events. Ultimately, live events that have large mass gatherings will be the last, quote unquote, normal to come back. The timing of that, though, is still up in the air. The order will likely be for a couple of weeks, and then we'll see what happens based on the health data and how Utahns are following it. We recognize that cities and counties are under a time crunch of mid-May at the latest to finalize 4th of July festivities. That's why our groups are working around the clock trying to determine if there are paths forward. One thing that we were told on an earlier call is that we may find ourselves in a situation where in some parts of the state, a mass gathering of a parade may be safe, whereas in other parts of the state it may not be safe, and that'll be done in consultation with local health departments. So stay tuned on that one. A lot more information to come in the days ahead. Question about whether we could go back to red, and Brandy, correct me if I'm wrong on this, but my understanding is that yes, health data is driving this, and so if the governor feels like we need to go back to red because of a spike, then that would be on the table. Is that what you're hearing on the commission side too?
That's absolutely correct, and it can be based regionally, either county or multiple counties, or even a community within a county, and it's data driven. And so as that's all launched, there's a website that they're in the process of developing right now to track cases and hospital utilization. What is the capacity? What would be the ability to respond? Those things go into that and identify ways that, or the criteria for which there could be a different designation. But we've heard it over and over again that that's a regional or a local approach. So something for you to be watching and paying attention to.
Perfect. Carolyn, you asked about short-term rentals with the rest period. My recommendation there would be to look at the orange recommendations around lodging and accommodations, and see if that type of approach is consistent with what is listed within that recommendation. Let's see. Nina, I think this is a great idea about easy to read graphic. I know there's a communication team that's working on this, and so Brandy, let's make sure we take that back to the communications team. Gina, you asked about concerns we're hearing about disruptions to the food chain and threats to local ag. Brandy, do you want to take the first swing at that one? That's a nice, easy one for you.
Yeah, we're aware of that. And I know as businesses come online as well, that there will be an influx in demand. Certainly have been involved in conversations with the Department of Ag as well. I know that there's been some grants that have been considered. And so we'll see if we can get some additional information on that and where those are. And maybe let me just also state that specific to different areas of the state being harder hit, there's, our communities that have national parks and the impacts on tourism revenue, and these different pieces where we're seeing it at the Association of Counties, and I'm sure the league is looking at this as well, as kind of putting together a toolbox of resources for these different industry specific, and also as governmental entities looking for ways to balance their budget on decreased revenues. We're in the process of putting information together relative to each one of those different aspects, and we'll be getting that out hopefully by the end of this week.
Yeah, and likewise on the city side, we on Friday will have some sales tax data for the 60 or so largest cities in the state that won't be projections in the traditional sense, but will at least be helpful for those communities. And for communities that are outside of the top 60, will help with understanding what the trends are as we know them now, above and beyond what Juliet mentioned at the town hall yesterday. The one thing I'll also add, Gina, about the disruption to the food chain is that there is a work group on critical infrastructure and that the League and UAC both participate on. There was a conversation just a few days ago about where the main pinch point was for the food chain supply and being able to get the goods to the marketplace. And interestingly, one of the biggest challenges that they were facing was the lack of access to truck stops and the lack of access to parking areas and bathrooms and places for truckers to stop, have a meal, and be able to rest before they continue. And so that was something that the overall Economic Response Task Force was looking at, was to try to free up that choke point so you could still have social distancing at some of these truck stops, but allow the flow of commerce to continue. Mayor Petro, you asked about.
Oh, yeah.
Oh, go ahead. Go ahead, Brandy.
Well, I was going to address that one as well. So there's a couple of comments here relative to masks specifically. So a comment.
Yep, take it away.
Great Basin Graphics in Logan has lots of masks. At the Association of Counties, we also have been working with a supplier and have access to masks, thermometers, gloves, that type of thing. And Cameron and I were talking about this last night. I need to get you that information, Cam, but we're coordinating an order so that we can facilitate the bulk ordering requirements. And we've allowed our counties to participate in that purchase. Then they can decide if they need it either for county employees or then also to help out their business community. I also wanted to point out the question about distributing masks statewide. In a call yesterday with the commission, I reminded them of the involvement of AOGs, specifically with what they've identified as vulnerable populations. And with the Meals on Wheels and some of the other senior programs that are coordinated through the AOG, I've reminded them that that's a resource as well as we try to get into these communities and get supplies and PPE where they need to be. So wanted to make you aware of that effort.
Perfect. It's an ambitious plan that the state is undertaking around masks, so stay tuned. Melinda, you asked about, oh, go ahead, Betty.
I should point out that in conversations that we've had with the different task force and even with the state, they're aggressively working on that front, but their priority is to frontline workers. And so we recognize that restaurants and other businesses are going to be trying to obtain those as well, which is where we feel like maybe if there's an opportunity where we can make that procurement and try and be helpful in that regard, that's why we're engaging in that effort.
Well, and in addition to that, one other potential pinch point to people returning to work is the availability of testing at work sites, especially off the Wasatch Front. So we've been involved in conversations about trying to expand the testing in central and southern Utah, whether those are full-on test sites or mobile buses that come for a period of time. And so stay tuned on those conversations. Hope to have more information in the days to come. Another pinch point for people being able to return to work is around childcare, especially since school will still be done from home during the month of May. So there is a work group that's working on trying to expand childcare options. The initial focus was for healthcare workers and first responders. That may be expanding in order to try to accommodate those who need childcare so that they can return to work under that orange phase. So Melinda, you asked the question around phase guidelines, if they're likely to change or be updated, and I believe Mayor Reeves had a question about that as well. The answer is that Utah Leads Together 2.0 at some point will be supplemented by Utah Leads Together 3.0. The key term there is at some point. We know that there are different aspects of 3.0 that are already being worked on, for example, around housing. The League has a couple of internal groups I've mentioned around live events and around recreation and quality of life services. And we are working on providing additional recommendations that could go into that 2.0 guidelines or the appendixes. So there will be, as we implement, there will be lessons learned and things that will go into that 2.0 document. So really, Friday is the beginning, not the end of the stabilization period, and the beginning and not the end of implementing 2.0. Brandy, any other thoughts on that one?
Just the simple answer is yes, I absolutely believe it will be updated and will evolve.
Perfect. Mayor Petro, can malls and department stores begin opening? This is a fascinating question because many malls and department stores closed because of market conditions, not because of a government order. For example, the City Creek Center in downtown Salt Lake closed because somebody tested positive, and then they felt like in order to be safe, they should close. It wasn't a health order from the Salt Lake County Health Department that closed City Creek. And so to an extent, it'll be a market decision whether to reopen. One major issue that Brandy and I have brought up repeatedly over the last few weeks has been the issue of public trust, whether the public trusts the actions that government is taking and also the consumer confidence in actually re-engaging with the economy if and when these businesses start reopening. So I think, Mayor Petro, the short answer is yes, but let's see what the market dictates and where the overall trust and confidence is in the public. Okay. Paul, you have a long comment here.
It's just a comment and not really a question.
Okay, well, let me at least try to address it. Based on the meetings I've been in, every discussion revolves around health data and ensuring that decisions are being driven by data. the tricky thing for the last few weeks is that we were collecting data as fast and as quickly and as fiercely as we could, but we needed to wait for the data to actually start to be assembled so that people could make decisions. And I think you're seeing those decisions this week. Randy, other thoughts around his comment?
Nope, I agree.
Okay, tracing capacity. This is a big one. Randy, do you want to touch on this first?
Sorry, I'm trying.
Yeah, this is Mike. All it says is BAI.
There's lots of comments.
And then I was,
Scan through them. It's great.
yeah, no, it's
Good
it's awesome.
dialogue going on in the chat. Yeah. So as specifically, I don't know, Cam, if you know specifically how many people are dedicated to that effort. I know that there is concern about testing, especially in some of our more rural areas. But as far as the question on contract tracing and dedicated to that, I don't know the answer.
Well, here's what I've gathered, Mike. We have been able to test upwards of 6,000 people over the last few days. They are still working on the tracing capacity, and in fact, Chris Cox has rededicated about 1,200 state employees to be able to work on tracing, and thus far they're only using about 10% of those on tracing as they are working on expanding that capacity. There's also been discussion about utilizing students or returned LDS missionaries to help with tracing. And the app that the state just released a few days ago will be very helpful on tracing. In fact, Apple contacted the state of Utah wanting to partner on a tracing app that could be used elsewhere. It is a voluntary app, but that's one of the tools in the toolbox around tracing. So I can't answer the specific data point. We can certainly track that down, but those are the different levers that are being pulled around tracing right now. Okay, so a lot of people who are saying that they agree with Paul. Our numbers are the second lowest nationwide and lowering each day. This is the key push and pull around a pandemic. In fact, Brandy and I were in a meeting in what seems like a lifetime ago, but it was the last few days, or the last day of the legislative session, where former Governor Mike Leavitt made the comment that that leaders during a pandemic will take criticism if they act in a way that seems harsh but stops the pandemic, or if they don't take strong enough actions and the pandemic gets worse, like you've seen in New York City. And so he said it's a tough position to be in as government leaders, and you just have to make the best decisions you can with the data that you have. So that's the best I can do, Haley, for your comments there and about how the state has attacked this. I think it's a really good sign that our numbers are so low compared to the rest of the country, and I think it's a credit to Utahns taking it seriously.
Cam, Jill Parker with the Local Health Departments Association is on the phone and can speak to the testing. We can give her a minute.
Fine by me.
Jill?
Hello, this is Jill.
Hi there.
Brandy, thank you. Hey, I just have a couple of updates on testing. I'm not sure who the question came from. Some of our rural areas have had a hard time with testing capacity. When the health officers or the hospitals request testing supplies, they're only getting them in increments of about 20 or 30 test kits. We tried in multiple ways to increase that testing so that we can get a better sense of what's happening statewide. And last night we heard that there'll be an additional 500 test kits deployed to central Utah, to the 6 counties of Central Utah Health District. And there'll be additional supplies also deployed to Southwest, which will also help, I think, with some of the critical infrastructure work sites down there that have been requesting testing and not able to get them. So as you're hearing concerns or questions about not having the number of the supplies, or please share that with your health officer. That's I think we found an efficient way now, hopefully, at least it was yesterday, to try to help with some of that. It's also important to note that while mainstream media may be saying that we're testing asymptomatic, they're trying to work on that related to contact tracing. So they're trying to work on a method that if you're a direct contact of someone who tests positive for COVID, that you can get kind of the green light, so that when you go to a healthcare facility, a healthcare provider, they'll provide the test for you. Right now, we know in our local communities, some people are getting turned away because they don't have one of the 6 symptoms. But as contact tracing, that capacity expands. And as Cam said, Chris Cox and Lieutenant Colonel Gailey have been great at helping us expand our ability to do that on a local level. We start to see the need for some asymptomatic people to be tested. So they're working on removing some of those barriers right now. So I hope that's helpful.
That is helpful. Thank you, Jill.
Yeah, thank you, Jill. And it's been a pleasure working with you over the last few weeks. So thank you for all the work that you're doing with the local health departments.
Oh, thank you. The feeling is mutual.
Mayor Mike, I see I missed the question about the mass gathering, and it will be 20 or less. And then somebody asked, how can you have a mass gathering with 20 or less? And I guess that's the point, is that mass gatherings in general will be the last to come back, but we are moving from 10 to 20 from red to orange. Evan Nelson asked about the expectation for public swimming pools. The league and UAC had a meeting today with about 20 cities and counties working through public swimming pools, recreation centers, playgrounds, all of those quality of life services that residents expect and rely on and want to enjoy during the summer. And that group was working on potential recommendations. The key takeaway, and I brought this up with Chief Harding and Lieutenant Governor, is that there is no one-size-fits-all approach to public swimming pools and parks and everything else, because every facility is different, and the ability for a city or county to meet the orange recommendations is going to be different. So stay tuned for more of those recommendations to come. Okay. So Mayor Can up in North Logan asked, does 20 feet or less require masks if we can do a 6-foot social distancing? Randy or Jill?
I understand it. The masks are required in, to go into places of like businesses, public places. And I'm trying to think of the perspective versus what we're seeing on the Wasatch Front and what I know the rural communities are seeing, because I know it's very different. So appropriately, yes, in places of public gathering, you're supposed to be wearing a mask. But as far as requiring 6-foot social distancing, I think as long as obviously visiting a restaurant, you're not going to be wearing a mask as long as you're in the smaller groups. So I don't know if you know something differently, Cameron, but I believe that the mask issue is in public places, such as businesses.
Jill?
I'm sorry, I didn't hear the question. Can you repeat the question, Cam?
It's if you're maintaining 6-foot social distancing and in groups of less than 20, are you still required to wear a mask? And if so, under what is it just anywhere, or in a public gathering, or in a place of business?
So I'm looking at the guidelines in the 2.0 plan, and under the overview of the guidelines for the general public, one of the things that it does call out is face coverings worn at all time in public settings. So it doesn't call out a distance at which face coverings would not be required or recommended. And it just says face coverings worn at all times in the public setting. So I think that's all the information that I have on that, is what's currently in the document.
Perfect. Then Gary H., which I'm assuming is Gary
Cameron,
Hill.
could I jump in for a minute? I apologize for interrupting. Could I jump in for a second?
Go ahead,
This is Gina. I just noticed, I'm looking at the document, Brandy, you sent us this, that has the color codings for each of those levels. And it says, under the orange, face coverings worn in public settings where other social distancing measures are difficult to maintain.
There you
So
go.
that's a little different than what we've heard in this conversation.
That is a little different, Gina. This is Jill. Thank you for pointing that out. One of the things that the health officers did over the weekend is they went through these guidelines. There were a lot of places where there were contrary, information, and I think you just caught one of them. So thank you so much for pointing that out.
And this actually comes back to the point Melinda made before and Mayor Reese asked about, which is 2.0 is a living document. And so as we identify areas, as we implement, we want to be able to share that information back with the State Department of Health so we can make those updates to the document. Gary Hill had a question, and Jill, I'm going to put you on the spot for this one about whether the state is sharing the transmission rate and if that information is available on a county level yet.
Cam, that does put me on the spot.
You're welcome.
Yep, thank you. I don't think I have that information, but let me look into it and then I can get back. If that's okay.
Perfect.
I believe
Yep.
that I believe that information will be available on the dashboard once that's live. I do. It may not be by county, but I think it is by district, by health district.
Mayor Daines, you asked about being outdoors on a trail that's a public space. Are masks still necessary? Jill, do you want to take that one too?
Let me look. I'm not sure where that landed. I know there was conversation about outdoor activity versus indoor activity, but I'm not sure in that latest update. I'm just going through the latest update of the guidance right now. So sorry, I don't have an answer for that, but I can find it.
Yep. And then just so everybody knows, we'll have all these questions, and so we'll review them. The ones that we weren't completely able to answer, I'm actually transferring them over right now so that we have them and can follow up in our upcoming correspondence. So the governor's press conference, speaking of which, is going to be starting momentarily. So the two last questions came in, Mayor Wilson Edwards, the good and the bad with Zoom meetings. Yes, we certainly have. Is it still recommended we hold meetings like City Council online? The answer is up to you. We will at the league continue to do online meetings like this one, but we have upgraded our Zoom account since yesterday, and UX actually administering this one today. So that's really up to your city on what you do. You think about the thousands of online meetings that are happening. Only a handful have been hijacked, so I think that's a positive sign. But certainly, it's up to your local government what to do. Have the guidelines been updated since last Thursday? There are a handful of updates from the commission, and then Brandy, do you want to hit that about some
Can
of
I
those
back up
updates?
just a minute relative to operations of county courthouses and city hall? Certainly something that each of you will need to be considering. Just before this call, I received a call from Commissioner Valentine with the State Tax Commission, specifically talking to me about DMV offices. And what he told me is that the governor will address DMV offices in his press conference tomorrow. And we'll be reaching out to our county assessors to talk specifically about that. But basically what he told me is that their announcement is going to be that they will be by appointment only. So certainly they're encouraging online options where the business can be handled online, but they do want to get the messaging out that those offices will be available or in-person visits by appointment only, and we'll be coordinating on that front. Since there are many state offices, but the state also contracts with counties, and those offices, most of them are in a county courthouse, so we'll be coordinating on that. But certainly something to think about, because I think in general, as far as the counties go, a lot of the public interaction is the DMV offices. So we'll follow up on that.
Perfect. And then the last question before we adjourn for the governor's press conference is from Evelyn and Sandy about enforcement. The fact that it'll be an order, not a directive, does bring enforcement into play. And so, Evelyn, let's hold on to that question, and we'll do our best to get a copy of the order and ask that question of the governor's legal team as he's putting the order together. Brandy, any final thoughts on that question? Leave it to Evelyn to ask the 800-pound gorilla question just as we're trying to wrap up.
Yeah, and certainly something to consider in your own local orders in the coordination with the state. That's something to consider and be talking to your local health official as well.
Great.
Hey, Cam.
Well, yep.
Cam, this is Jill. This is Jill. To Mayor Dane's question, I'm going to send a link to you and Brandy with the phased guidelines related to masks, call out CDC guidance. So I have the link to that I'll send to you for you to send to your membership.
Perfect. Well, and for everyone on the call, Brandy, Jill, and I talk on a regular basis, multiple times a day over the last few weeks. And so as you have questions and other things arise during implementation, please use us as resources. Thank you for joining the call. Brandy, Jill, any final thoughts before we switch over to the governor's Facebook page?
Nope, I just want to inform the members that we're certainly working on the CARES funding. So any information that you have on expenses that you've incurred that you can share with us, that is helpful for us in advocating for those funds to get to the local agencies.
Great. Yep, likewise from the league. So thanks everybody for your time today, and let's go check out the press conference.
Thanks, Cam.
Thank you.
Thanks everyone.